Hi there. Hi, everyone. I'm Rendy Murphy, epidemiologist and director of disease control at the Mobile County Health Department. I'm coming to you today, Monday, February 21st, to give you a brief update on the impact of the COVID-19 pandemic on Mobile County. If you've been watching the news or listened to the radio, you know that things are looking much better on the COVID front. Hospitalizations have been decreasing. Cases are way down. Deaths are starting to turn downward, week over week. So we're super happy about that. And also, emergency and office visits for COVID-like illness and influenza-like illness are extremely low. And then that percent positive that we look at is going down as well. In Mobile County, around like 11, 13% or so of the tests that are reported to us are positive for COVID-19. So again, the number of cases that we're seeing and the percent positive that we're seeing, those are the two indicators that decide what level of transmission we're in. So those things are still higher than we would like to see them that we've enjoyed in the past, back in November and early December, where we had just, a dozen or two cases reported each day and less than 5% of the tests were positive. We still want to get there. So we're not quite there yet. So for now, we are still considered in a high level of community transmission. Yesterday, there were 124 people hospitalized with COVID-19. That is improving. Cases are improving. Percent positives improving. But we are still in a high level of transmission. So please remember to get boosted if you've already been vaccinated. If you haven't gotten vaccinated yet, it's not too late to begin that series. And if you are an indoor setting, it's still a really good idea to wear a mask. And if you're in an outdoor large gathering where it's hard, to keep your distance or to wear a mask, maybe you're eating or drinking or celebrating, we want you to keep doing those things to try to protect yourself and your family. Yesterday, we had 0 additional deaths reported to us. So again, things are looking much, much better. On the sort of breaking news, I think we've talked about the fact that the decision as to whether or not to approve or to authorize a vaccine for infants, so children aged 6 months to 4 years, has been postponed until April. There has been some discussion. I get lots of questions about when can I get a fourth dose, when can I get a fourth dose? And what I've seen in the news is that it likely there won't be a fourth dose authorized until fall. At least those are the early discussions. So remember, if you are healthy right now, most of us have gotten a 2-dose primary series and a booster, or a 1-dose primary series if you got J&J and then a booster. But there are some considerations for people who got Johnson & Johnson and anyone who is immunocompromised to potentially get additional doses. So, talk to your provider, give me a call if you want to talk through that. But right now, there is not a fourth dose authorized in the way that most people think, right? So just stay tuned for that. Also, there's been some information in the news that CDC is taking another look at their masking recommendations. This is something that we're going to start. This is going to happen as we continue, right? When or if transmission stays high or gets high or it's going up, then you may see, we want to grab some of those public health measures off the shelf and re-implement them to try to slow things down. And then as things start all moving down and going in the right direction, we may start talking about lifting some of those restrictions or those recommendations. So I think that CDC is considering, changing some recommendations about wearing masks. Just a couple of weeks ago, they recommended that everybody wear an N95. So now that things are looking much better on the COVID front with the Omicron wave, hopefully the worst of it behind us, there is talk that CDC may revisit those guidelines. Though for now, they are still saying that the best thing to do in in-person learning, particularly in K through 12 schools, is to implement universal mask wearing. So remember, most kids are too young to get vaccinated if they're in elementary schools. And we know that kids are likely not going to be as sick, so they could be asymptomatic carriers and bringing COVID home and other respiratory viruses home to their parents, grandparents, and caregivers. So still a strong recommendation to mask in schools. All right, just a couple of questions. Last week we talked about the fact that people who have received monoclonal antibody treatment or convalescent plasma for treatment of COVID-19 no longer need to defer vaccination. And the question is that because antibodies from natural infection are now thought to not persist for 90 days? So let me, it's kind of a 2 or 3 sided question there. So initially, when we had people getting treatment with monoclonal antibodies or with convalescent plasma treatment, we wanted them to defer treatment defer vaccination back when there were limits on the vaccine supply. We also didn't have a lot of data on the synergy, both either positive or negative, that vaccination might have with treatment with monoclonal antibodies or with convalescent plasma. So there is more data on that now. We have a lot more vaccine. And so again, CDC has lifted that recommendation to defer vaccination for people who've had monoclonal antibody or convalescent plasma treatment. And then someone just asking, how do I feel about Mardi Gras this year? Parade's back to normal. Nobody's wearing face coverings. Again, you need to be careful to protect yourself, and your vaccination status, your health status, so you can do things to reduce your risk if you're going to be in any of the Mardi Gras settings, whether they be at outdoor parade or at indoor at some of the social gatherings and balls and that sort of thing. So if you want the highest level of protection, get yourself vaccinated, get yourself boosted, wear a mask, keep your distance, make your time at these celebrations shorter than you might normally. Get tested before you go and about 3 days after you attend an event, again, so that if you did contract COVID while you were at a gathering, you can find that out and stay at home so that you're not out infecting others. So yes, we are all ready for things to get back to normal. And to do that as safely as possible, just remember, layer on some of those prevention measures to the extent that you feel comfortable with. And remember, testing is your friend in a time like these so that you're not inadvertently spreading COVID around and not know it. So to that end, last week on Friday, we reopened community testing at our Festival Center location by appointment only. Again, this is our Festival Center location. I think it's 3725 Airport Boulevard, Suite 101A. We have a big marquee sign out there now, so it should be easier for people to find. You can make an appointment by going to appointments.mchd.org. And if you just type that in, you may want to, put the prefix on there, the https:// and then appointments.mchd.org, so it'll take you directly to that appointment interface. We can take up to about 100 appointments a day. On Friday, we did, I think, 32 tests. So we have more appointments than we need. So right now we're doing okay. When I looked this morning, there were a few dozen people who had signed up for testing today. We open at 9. The first appointments are at 9 o'clock, and the last appointments are at 5 o'clock. So if you need a 5 o'clock after work appointment, go in early and reserve your time. We'll be doing this right now. We're planning to do it at least through March 11th. So that is our plan right now. If circumstances or supplies change, we may decide to extend, but right now, again, this is at the corner of Airport and Montlamar, and we are testing there by appointment only.
Those links are on our website.
Monday through Friday. Okay. And Mark is saying that the link to the appointment scheduler for testing is on our mchd.org site and also on mchdcares.com. So that is good news. The other good news is that while you're there, if you test negative, you can get vaccinated. So we are still providing all 3 vaccine products at our Festival Center location. So please go start your vaccine series if you have not already, or get your booster if you've not been boosted, just so that you can be, the new terminology is up to date. We want everybody to be up to date with their vaccine recommendations for COVID-19 to protect themselves. So in addition to our Festival Center location, we are still doing some community events for vaccine. It looks like this week we're going to be at Pine Grove Baptist Church in Mount Vernon from 3 to 5 on Wednesday. on Thursday at New Hope Outreach Ministry on Spring Hill Avenue from 10 to noon. Remember, go to mchdcares.com, and that is where you will find all of our vaccine events that we're doing. We may be cutting back on community vaccine events because there's a very low demand for vaccine right now, and as you can imagine, it takes a lot of people and resources and stuff to have vaccine events out in the community. So we have our Festival Center location. We're continuing to do 1 day a week at the Sims Clinic in our mobile medical trailer. We're still doing in-home vaccinations. Again, go to mchdcares.com to sign up for an in-home vaccination. And then we're also boarding vessels to offer vaccine on cruise for vessels that come into the Port of Mobile.
Saturdays here. Keeler.
Oh, yeah, and thank you, Mark. On Saturdays here at our Keeler location at 251 North Bayou, we also provide vaccine walk-in only or walk-in, no appointment necessary on Saturdays from 8 to 12. So as you can imagine, we've got a lot going on, and, if we continue to see, 0 or 1 or 4 vaccines at our community events, we may start to cut back on those so that we can use our resources where we are getting more bang for our buck with people needing vaccine. All right. I've just got one more thought. Go ahead.
We're not here next Monday.
Oh, that's right. Mark's reminding me that next Monday, the 28th of February, and Tuesday, March 1st, our agency is closed to the public because of Mardi Gras. So we will have inspection services folks and other people in the agency doing work behind the scenes, but our clinics and offices will be closed to the public. And again, just encourage you to celebrate safely. So I want to turn to something that's a little bit more maybe personal to me, or maybe very close and near and dear to the hearts of our agency. So today I just want to read, this is the last full week for Dr. Bert Eichhold, who's been our health officer for 31 years. This is his last full week of employment at the health department as a full-time health officer. He may be doing some clinic work afterwards, but he is set to retire, and he released this statement today. As of March 1st, 2022, Dr. Kevin Michaels will be the health officer of Mobile County, Alabama. He was born in New York and educated Wofford College for his Bachelor of Science, University of Alabama School of Public Health for an MPH in Epidemiology, and University of South Alabama College of Medicine for his MD. He honorably, so we're talking about Dr. Michaels. Dr. Michaels honorably served our country as a U.S. Army command surgeon and retired in 2016 as a colonel, or 06. He's been working in our community and private practice before joining the health department as our CEO, so we want to welcome Dr. Michaels. And then Dr. Eichhold goes on to say that since May of 1990, it's been an honor and a pleasure to work with the MCHD family. We've done some amazing things, and I'm very proud of the many MCHD accomplishments. During the COVID-19 experience, the application of science, knowledge, and common sense has had a very positive impact on disease control. Wishing everyone health, happiness, and continued success in the future. My personal thanks to everyone for the many personal and professional efforts to make Mobile County healthier for everyone. So a press conference is planned for Friday. Dr. Scott Harris, the health officer, will be at our location to say a few words, and we're very much looking forward to that and celebrating with Dr. Eichhold. And I just wanted to say, wow, 31 years of public service to this agency and to the Mobile community, Dr. Eichhold. 31 years of tireless work and countless sacrifices to promote, improve, and protect our health and wellness. I'm personally grateful for you adding me to the MCHD family in September of 2019. It's been my proud honor to serve you and this community. Dr. Eichhold, I will miss your laughter. I will miss your passion and grit, your history lessons, your limitless supply of war stories, and our spirited discussions about science and data. You've done your best to prepare us for whatever comes next. So please enjoy your retirement. knowing we'll take care of this family so that you can focus on yours. And know that I'd go to battle with you again in a heartbeat. Thank you. Y'all have a good week.